Have- So today, inshallah, we will discuss about the strategies for a healthy Ramadan. As you know, Ramadan is fast approaching, and may Allah make this Ramadan really fruitful for us, and make it easy for us so that we can use it in a maximum way and to maximize the spiritual blessings as well as health benefits also of Ramadan. And may Allah enable us to have a healthy and good Ramadan, inshallah. So for that, we'll see what strategies we can use which are in line with human metabolism and for which we can use for achieving that. So topics we'll cover inshallah today is first of all preparation for Ramadan. It includes mental, physical, and spiritual preparation, and then next how to maintain energy levels while fasting, Ramadan headaches, coffee or tea withdrawal, how to deal with it, sleep management, strategies to avoid dehydration, ideal suhoor and iftar, maintaining muscle mass and exercise in Ramadan, constipation, exemption, and who are the people who are exempted from fasting, and how to deal with sickness in Ramadan, and protocols for those who really struggle to fast, and then how to apply the lessons and the practice which we get in Ramadan for having a healthier living after Ramadan also. So, to start with, preparing mentally is very important for having a smooth Ramadan, a healthy Ramadan, because what we think mentally, it has effect on the whole body. And in the medical terminology, we have a term called nocebo and placebo. These two terms we use. Generally, if what nocebo effect means is that if somebody is having negative expectation of regarding any procedure, any treatment, or any process, then it causes them to have more effects, negative effects than it would normally cause. So, like some people, they're taking undergoing some surgery or some procedure, and suppose they are too much anxious about it, too much they are having negative expectations about it. They are fearing that they will may get a lot of complications, or they may land up into a lot of trouble, and it will be very painful, and it will cause a lot of harm to their body or all these things. Then such people generally it is seen that they really do have no more than normal side effects, and compared to those people who think that this whatever procedure I am undergoing or whatever medication I am taking, this will be good for me and I won't have any problem with it, and it will be helpful for me. Those people, they really get more than expectation. Their experience will be good, their benefits will be more. So that is called as placebo effect. So placebo for positive thinking, having a positive effect on the outcome, and nocebo is negative thinking, causing a more than normal, more than expected negative thing effect on the person's body due to his mind. So we have to. So if we apply this principle in Ramadan fasting, this thing is, if we really are stressing about Ramadan, oh, Ramadan is fast approaching, and I have exams coming up also during Ramadan or immediately after Ramadan, or I have a very busy schedule, and I have also so and so personal work. How am I going to do it in Ramadan? It will be causing a lot of problem for me. Oh, I'll be fasting, I'll be thirsty, I'll be hungry, I'll be tired, I'll be stressed out. How I will manage? If we have all these negative things about in thinking about Ramadan, then believe me, according to the nocebo effect, you will have a lot of problem. So this is not what we have to go through actually, because according to one hadith in Sahih Bukhari and Sahih Muslim, Rasulullah said that Allah Subhanahu wa Taala says, "I am as my slave expects me to be." So how we expect, what expectation we have from Allah, we will get that. So if we have negative expectations, if we think that, oh, if I fast I will suffer, I'll fall sick, I'll be weak, I'll not be able to do my work, I'll not be able to do my duties, I'll not be able to study. If we have all those negative expectations and badgumani regarding it, then believe me, you will have same problem. So we have to really avoid such negativity before Ramadan. And believe me, the human body, Allah subhanahu wa ta'ala has made in such a way that we have enough metabolic capacity. Every healthy person has enough metabolic capacity in his body to fast without having much problem. You won't starve if you just don't eat for 13, 14, 15 hours. And as long as you have a healthy body and healthy liver and no diabetes and no serious diseases, you any healthy person can normally fast without having much trouble actually. Because you see in the liver, you have every person, normal healthy adult, has 100 grams of glycogen stored. The glycogen is a way body stores glucose in his body, in the body. Okay, so 100 grams in the liver glycogen, and then 500 grams of glycogen is stored in the muscle, and then so this totally will be 600 grams. So 600 grams of glycogen will give into totally around 2400 calories. So that is a normal daily requirement of calories for a adult male. 2400 calories. So how much we need the calories for a adult in 24 hours? That already is there in the body, stored in the liver and muscles in the form of glycogen. So a person who's having a normal body should not have any problem at all. Already it is there. And apart from that, you are also having suhoor. So those that food you are taking suhoor, those calories also will add up to it. And then we have fat in the body. So when fasting state, the body switches over to the fat metabolism, and it starts to burn fats. So the burning of fat leads to fatty acids in the blood, which are used by the heart and muscles directly as fuel. They don't need glucose directly, they can use fatty acids. And then liver can also make ketones. So this ketones can be used by the brain and heart and kidneys and liver and other organs for fuel. So anyhow, we have lot of fuel stored in our body. If we are fasting in Ramadan, there will be no problem at all, inshallah. So mentally, physically, and metabolically preparing for Ramadan is we have to, if you want to fast tune our body, if you want to prepare our body really for fasting in Ramadan, then the best way to prepare is by fasting before Ramadan itself. So, as Rasulullah Sallallahu Alaihi Wasallam has recommended, fasting every 3 days of every month in the middays, and also fasting on Mondays and Thursdays is recommended. And so, this if somebody does this fasting regularly every month before Ramadan, also, then they will not have any problem at all. And if few days before Ramadan, like in Shaban, if the in the first initial 1 or 2 weeks, if we keep a few days fasting in Shaban, that is also again helpful. It helps the body to metabolically prepare for fasting. So the body enzymes and the cells will be all set to be able to use their fat metabolism properly and to be able to fast without any problem at all. So there's one thing. I mean, those people who have difficulty in fasting in Ramadan, they can try this. They start fasting before Ramadan itself. So a few days, if they fast in Shaban, then their body will be attuned to it, and it will be more easier for them to fast in the entire month of Ramadan. So we can do this also step by step. That is in Shaban. What we can do is initial few days of Shaban. Initially, we can just skip one a meal in the lunch, and then we can have next step is we can have wet fasting from suhoor time to iftar time without eating any solid food, but you can drink only water. So, and then next you can fast few days of complete fasting. Then you can do trial fasting before Ramadan for chronic disease patients also, like some diabetics or some hypertensive and or other people who don't have severe disease. They can see if after consulting their doctors, they can see if their body can tolerate fasting in Ramadan or not. So that is called as trial fasting. So we can do this in Shaban, a few days, 3 4 days. We can try and see if our body is able to adapt to the fasting, and if it does, then fine. We can continue the whole Ramadan month fasting without getting any problem. So these are the strategies for optimizing our metabolism of the body, particularly in cellular enzymes of the liver and other organs, so that they can be prepared to produce fuel to meet the body's needs in proper optimal way. So then coming to the spiritual and mental fasting, mental preparation for fasting. See, if we see the Sunnah, Rasulullah Sallallahu Alaihi Wasallam used to pray, make dua right 2 months before for Ramadan itself. For Ramadan, he used to say, "Allahumma ballighna Ramadan." This is mentioned in the hadith in Bayhaqi and Tabarani, and it's also mentioned from regarding the Sahaba and the Tabain and the Salaf, the earlier generations, that they used to make dua to Allah subhanahu wa ta'ala almost 6 months before, from 6 months before Ramadan itself, they used to pray, Ya Allah, make us Ramadan, reach Ramadan safely and keep me safe for Ramadan and accept it from me. I mean, if we have this attitude, if we are praying and anticipating in a good way about Ramadan, and we are looking forward to it really spiritually, and then automatically our body will get attuned to it also, because what mentally what you think and prepare for, your body also makes preparations for it. So this is one good way. And then fasting in Shaban is recommended, as we already said, and it is mentioned in the Muslim Sharif, in a hadith, that Aisha Radhiyallahu anha, she said that I never saw Rasulullah Sallam fast in any month more than he fasted in Shaban, that is apart from Ramadan. So the most maximum number of nafil fast Rasulullah Sallam used to keep in Shaban. So these are the ways in which which make us spiritually and physically and mentally prepare for Ramadan. And so, with this preparation, if we enter Ramadan, inshallah, things will become much easier. Uh, and also at the beginning of the just before beginning of the month of Ramadan, we should make our schedule. I mean, adjust our duties, our work in such a way that we don't get too much stressed out. You see, we can plan all the work which can be physically tiring or physically more demanding. We can schedule that work either before Ramadan or after Ramadan if it is possible, and whatever other work we have in in the home or in the family, any things, tasks are to be completed, or at the workplace, all this we can schedule in such a way that we don't get stressed out during Ramadan. And also we need to read about the ahadith of the fadail of Ramadan before Ramadan itself. In the last few days of Shaban, we need to sit together as a family in the home and then read about the various ahadiths which describe about the greatness of Ramadan fast and the reward which Allah subhanahu wa ta'ala will grant us for it. So if we do all these things, then things will become really much easier for everyone in the home, and there will be a really excitement, spiritual excitement will be there in the entire home, in the entire family, for welcoming Ramadan in a most positive way, and everyone will be attuned to it, and things will become easier, inshallah. So this is what is recommended. And next thing is, once you start fasting, how to maintain the energy levels during the fast. So what is most critical for it is having a proper and healthy suhoor. That is very important, because if we don't have proper suhoor and if we don't take proper food and drink during the sahar time, then what happens? The body will not be able to replenish the glycogen stores properly, and then you will feel weak after a few hours of fasting. So better to have a suhoor. Skipping suhoor is not at all good. And then also, if you are feeling down, if you're feeling weak, then during fasting hours, particularly before the iftar time, suppose, then just if you lie down, then things won't improve. That time, if you have some work to do, then better to have some brisk walk. Then your glycogen stores in the muscles will get mobilized, and then body will start using the glycogen in the stored in the muscle for getting the energy. So That way you can get your work done. So that is one way which we can get energy. And then also taking a light walk, a brisk walk for a short time, that can improve your mental status also, and which will give more positivity and energy to work. So also people can use some supplements like L-carnitine or medium chain triglyceride oil. These two supplements are used by people for particularly who do gyms or do very hard work. They use generally for this. But we can use this with consultation of your doctor. You can use this supplement if you really have problem in maintaining blood sugar in the body during fasting. So next, coming to Ramadan headache. Many people suffer from headaches during Ramadan because either due to low blood sugar in the in the body, or due to low blood pressure, or due to caffeine withdrawal, because we won't be drinking tea or coffee during Ramadan fasting. That again causes headache. And also because sleep pattern is disturbed during Ramadan and the number of hours is less we get for sleeping. So these all these factors can contribute to getting headaches. So we need to sort out all these issues and to overcome the problem of headaches. And then some people might get migraines. So those who are suffering from migraines or other such types of headaches, they can consult their doctor before Ramadan itself and try to see whether they can take painkiller skin patches during fasting if they get severe headaches. So, because they won't be able to eat any medication, any tablets, so they can just take a skin patch. They can, and then that will decrease the pain. And those who are addicted to cigarettes and nicotine, they can also use nicotine patch during Ramadan to get over the withdrawal symptoms. And how to address the caffeine withdrawal? Suppose somebody stops the taking tea or coffee suddenly during Ramadan, then it'll cause a lot of problem to them, headaches and all that. So to avoid that, what we can have three strategies. One is you can taper off the using caffeine before Ramadan by about 7 to 10 days. So second is you can drink your usual how much you draw coffee or tea you drink. You can drink it at Suhoor time itself. But only problem is if drinking tea or coffee in Suhoor will cause more diuretic effect. That is, it will cause more urine formation and you may lose more water. So that is one problem it can cause. But however, if you are not able to control, then you can have at Suhoor tea or coffee. And also there are extended release caffeine formulations available in the market. So you can just take some caffeine supplements which are long acting. So at so time if you take, then it'll release the caffeine slowly in the body throughout the day. So you won't have any withdrawal symptoms. And how to taper off the coffee? That is, you can start 7 to 10 days before Ramadan itself. Like this, now, if you start from today, suppose you can just half the dose of the coffee you're taking. Suppose somebody is taking 2 cups, then they just make it to half. Take only 1 cup of coffee for 2 days. Then after that, for 2 more days, you just take half cup of coffee. Then after that, make it one fourth, and then you can just leave it. So 2 to 3 days if you take for each step, then within 7 to 10 days you can just taper off. So your body will get slowly attuned to staying without caffeine also. So this is one strategy you can use. And next is sleep management. Because we of busy schedules during Ramadan and Taraweeh and late sleeping and then getting up early during Sahur time, so we don't get proper sleep at a stretch. So this causes problem for some people. So at that time, what we can do is we can instead of sleeping all straight hours during the night itself, you can compensate by having a polyphasic sleep schedule. Like you can sleep in 2 3 installments. So you can again sleep after Fajr for couple of hours if time allows. If your office time allows, then you can after Fajr again you can take for 1 to 2 hours sleep. That will be helpful. And also try to sleep after Taraweeh as soon as possible. So people generally what they do is they come after Taraweeh and then again they spend time chit-chatting and calling friends and other things and they unnecessary talking for hours together. So they'll be delaying sleeping. So that sleep time will be disturbed. So better to plan in a schedule of sleep in such a way that after Taraweeh immediately come home and sleep and then get up for Suhoor. That's the best thing. And if that is possible, then fine. But if sleeping after Suhoor is not possible also for people, then they can take nap in the afternoon if there is if time allows. Like because you won't have lunch, so that time of lunch will be saved. So the half an hour of lunch time you can utilize for sleeping, taking a short nap. You can just lie down in the masjid in a corner or in the office itself. You can just put your head on the table for some time and then just try to relax, go into a deep sleep of relaxation, a deep relaxation state to compensate the lack of sleep. So this also helps in getting fresh for some time. And then also, before sleeping in after Taraweeh, we should try to avoid using screens and phone because if you use phones or screens on before sleeping, then it will disturb your sleep pattern. So after Taraweeh, no phones, no gadgets, no screens, no television. Just come and sleep. Check any messages, just do it before Taraweeh itself. After Iftar, finish it, whatever work you have, do it. And then don't sleep on a full stomach. That is, some people, what they do is they have very heavy iftar. Then after that, they'll not eat their dinner fully. Then they'll come back after Tarawih and they'll have a full dinner. So then they try to sleep. That becomes a little bit difficult because on full stomach, if you sleep, you'll get reflux and sleep will be disturbed and you won't be able to sleep properly. So better to have at least 2.5 hours of gap from your dinner time to the sleep time. So don't try to eat heavy things after Taraweeh. Whatever dinner you want to finish it at after before Taraweeh itself. And then after Taraweeh, if you want to have, if you're feeling hungry, just have some light snack, not anything heavy. Just light snack and then just sleep. And then try to maintain regular schedule of sleep because the body gets attuned to the sleep time pattern. So if you keep changing your sleeping and waking time every day, then your body will be able to adjust it and then you won't be able to sleep properly. And then also lowering the room temperature helps in getting sleep faster. So that we can follow these things to have a sound sleep and improve the quality of sleep because the quantity of sleep is decreased. So at least the quality of sleep improves, then the body will compensate and it won't get tired too much. Sleep. Next important thing in fasting is proper hydration. So I think this year, on the second half of Ramadan will be in summer, and so we need to take care of proper hydration. And just drinking lot of water, plain water at suhoor time is not enough because everything will go out in the form of urine within 2-3 hours. So just drinking a lot of plain water won't be enough. What you need to do is you need to take some electrolytes and like sodium and glucose, food containing sodium, glucose. If you're taking during summer time, then it helps absorbing the water more in the body and retaining it for longer time. So, like, suppose we are eating food at sahur time, which contains also some salt, like normal amount of salt, how much you eat, and you take some curd, buttermilk, and something like ORS or skimmed milk or kefir. All these things, if you add along with your drinking water, then your whatever water you drink will be absorbed and properly and will be retained more. And also, drinking too much water immediately at iftar time also is not good because immediately after iftar, if you drink too much water, again your blood will get diluted and the electrolyte concentration will decrease, and then you may feel fainting. So better to drink in a moderate amount and not too much suddenly. So this is important to remember. And if those people who are working in the sun outside and who have more problem of thirst during Ramadan, then they can take ORS solution. The oral rehydration solution is there that they can take during the time, so iftar time. So if you drink ORS solution, or if ORS is not available, you can take even skimmed milk also is very good. Skimmed milk or even whole milk also no problem. You can take that helps in retaining, or even buttermilk with little bit of salt added to it. Buttermilk also is very good for retaining the water in the body for longer time. So next is what is an ideal suhoor? So the importance of suhoor is there in the Sharia. We see in a lot of ahadith, Rasulullah has mentioned that you must take the pre-fasting meal, that is a suhoor meal, for it is a blessed meal. So there is blessing in suhoor, eating at suhoor time. So we should take this blessing of Allah, because without this blessing of Allah, then we'll have more difficulty in fasting. So and in another hadith in Surah Nisai Sharif, Rasulullah has, it is mentioned, report from Rasulullah that verily it is a blessing that Allah has given you. That is about the suhoor. It is a blessing that Allah has given you. So do not abandon it. Do not leave it. And then it is also important that you should delay the suhoor time till the just before few minutes before the end of suhoor time, because some people do is they will be not they will not be able to sleep properly, and because they are feeling sleepy at suhoor time, they don't want to wake up early. What they do, they just wake up few minutes before the suhoor time ends, and then just drink some water, and that's it. So, or some people, what they do is they eat at late in the night at 1 o'clock and to 1 or 2 o'clock in the night, and then they sleep, and then they won't get up for suhoor. They'll get up directly for fajr time. So this is not good. I mean, you try to delay the suhoor meal till the last. That is, there is barakah in it, and that is what the proper method of sunnah is. And various hadiths are mentioned about it. And the goals at Sahur are to optimize hydration and to replenish the liver and muscle glycogen and have sufficient fuel to get through the day. So this is important to have a proper balanced diet during Sahur. That is, the diet should have proteins as well as healthy fats and carbohydrates, complex carbohydrates. This is very important. Because suppose you are totally no, avoiding carbohydrates, then again your body will get dehydrated, because carbohydrates help in storing water also. With 1 gram of glycogen stored in the body, there are 4 grams of water also will be stored along with it.
Our meeting
So the
so
more glycogen stored, the more water also will be stored. So this is important, and but not don't take plain carbohydrates like just sugary drinks and all. Avoid juices and sugary drinks. Take complex carbohydrates, that we take whole wheat, rotis, or brown rice, or millets, or whole oats, or fruits which have good fiber also along with it. So these things we are having, which have complex carbohydrates, they break down more slowly, and then they you help your body release the glucose slowly. So, and also we should not overeat at suhoor, because overeating is pointless, because आप जितना भी खाएं, what how much ever you eat in suhoor, after a few years your stomach will get empty and you will start feeling hungry. That is natural. So just stuffing your stomach too much will only make you more miserable actually. You won't be able to pray your fajr properly. You won't be able to do proper sajda and ruku because of over distended stomach. And you, if you are trying to sleep after fajr time for a couple of hours, then you won't be able to sleep also properly if you are stuffed totally. So avoid overstuffing. Just eat moderate amount of food, moderate amount of water, and then avoid oily, spicy food and overdoing salt intake. Don't take too much salt. Salty food or oily food and spicy food, this should be avoided. Nowadays, the very bad trend has started in some cities. People are going to various restaurants for suhoor. Yeah, as a outing, with families and friends, they are going to enjoy eating outside at Sahur time. I mean, that is totally not recommended at all. I mean, you eat heavy food outside just before Sahur, that's going to make you miserable, and it'll overburden your digestive system and cause a lot of problem. So even if you want to have something, some party, have it after iftar, not at Sahur time. And taking food like Greek yogurt or kefir, this is good because it has good amount of proteins and also good for hydration. And then you can take some dates or some fruits actually, because this will help in hydration also. And then try to add some high protein diet like eggs and meat and oatmeal. I mean, and any other thing which you normally eat in your homes normally, but try to make sure that they are in a healthy way, and they cover all the healthy things: protein, fats, and carbohydrates, all vitamins, all should be in a proper proportion in the food. And then suhoor also, Rasulullah has recommended taking dates at suhoor time. So those who are diabetics, they can, if the sugar is not under control, then they have to try to avoid taking lot of dates. Just take one or even half a date is enough to fulfill the sunnah. Even at iftar time also, if those who are diabetics and doctor recommends them not to take dates or any sweet things, just you can take half a date, and also select those dates which are not having a high glycemic index. Like, some variety of dates like sukari and all, they are very sweet. And some dates like ajwa, and these are having low glycemic index, they have less amount of sugar. So you can choose those dates which have more fiber and less sugar content in them, those varieties, and eat only one. And also eating dried dates, the dried dates have less amount of glucose. So we get in the market some dried dates, you can just soak them in water overnight, or for a few hours also. If you soak them, they become soft, you can just eat them. So they are also dates anyhow, so your sunnah will be fulfilled, and without disturbing your sugar levels. So iftar, for during iftar, we should remember that we need to avoid focusing too much on lavish dinner iftar during iftars. Because nowadays we got a trend that people are throw iftar parties, and then during iftar parties they have biryanis and a lot of heavy stuff, and this is not good. I mean, dinner Ramadan is a month of fasting. It is not supposed to be a month of feasting. And unfortunately, we have given impression that a lot of non-Muslim friends, they think that Ramadan is a month of Halim, or Ramadan is a month of having exotic food, and they think that Muslims really focus on eating in Ramadan. I mean, this is because of our own practice. What we have done, we have given this image to other people. I mean, actually, Ramadan is not about feasting; it is actually about fasting. We should focus on fasting. So that is important actually. Uh, and also, other thing is that some people go to other extreme. They think that okay, Ramadan is coming, so anyhow, I'm not eating. So let me lose some weight. Let me plan to make Ramadan a month for dieting. So that is also not correct approach. See, anyhow, in a healthy way, if you have your healthy iftar and healthy suhoor in a routine way, then every person will lose at least 2-3 kilos. Normally, you will lose it without over focusing on losing weight. Even with the normal balanced diet during iftar and suhoor, you can easily lose 2 to 3 kilos of your weight, body weight, and that is healthy. But don't try to focus to lose more than that, because then you'll get weakness, and then you may have difficulty in fasting. So the our relationship with food should be in a balanced way. And how to avoid overeating during iftar? The best way is that immediately with iftar time, just take some dates and some fruit and water. Go for Maghrib prayer. Stop your iftar. Don't take extended iftar. Just go and pray to your Maghrib. And then once you come back from Maghrib, already some 20, 15, 20 minutes would have passed. and your body would have got time to absorb that whatever you have drank and eaten, and then the body won't confuse your hunger signals. You see, because what happens is, if you start eating iftar and you complete the entire meal that time only, then at the same time, then what happens, it takes some time for the body to read the signals in from the stomach, so the body will still think that you are hungry even though you are eating. So you should give your body to digest little bit whatever you have eaten, and then that once that food starts getting absorbed, then your body will get the proper signal to the brain. So then you will get the satiety. Otherwise, if you start eating and you continue eating the whole meal at iftar time itself continuously without any break, then your body will stop giving, will not give any signal that you are already full. So you will overeat. So this is one way we can avoid overfilling our stomachs. And also, body sometimes confuses thirst for hunger. So actually, your body will needs water, but the confusing signal will go that you are hungry. So you will start eating something instead of drinking water. So that is again a trap. You see. So to avoid that, you drink some water also, have some fruits and some dates, and then take a break, few minutes, 15, 20 minutes, half an hour. Then afterwards, you want some to finish it, you can come back and finish after Maghrib. And then finish your dinner before Tarawih so that you won't get gastroesophageal reflux when you sleep in the night. And also, again, same thing, avoid oily and spicy food because they'll upset your stomach and you'll have problem. And believe me, a lot of people, I mean, a lot of people come to the hospitals with problem of gastric upset, vomitings, diarrhea, and gastritis, a lot of problems in Ramadan because they don't follow the simple diet rules which the body necessary for the body to be healthy. So they overstuff themselves, eat all unhealthy junk food, eat all oily food, spicy food, and eat like anything. And then afterwards they'll suffer anyhow. Then they'll go to the hospital unnecessary. So you want to avoid going to hospitals, then have moderation in your eating. That is very important. Eat moderately. Ramadan is about fasting, not about feasting. It's very important. And also very important to have proper protein content in your iftar also. Because if you don't take proper proteins, then your body muscles will start breaking down in fasting. And next, coming to maintaining muscle mass in Ramadan. So some people, those who are particularly going to gym and all that, they are also worried about losing muscle mass. And then also, normal people also, if they are fasting without taking proper precaution, they may lose their muscle mass. So for that, to avoid losing muscle mass, you should have sufficient amount of protein uptake. That is at least 1.6 to 2 grams per kg body weight of protein should be taken per day. And so you take high protein content both during iftar and suhoor, both times. Take good protein in your food, and then also have proper calorie intake. If you restrict calories too much, then your muscles will be broken down for taking calories. And then you can do some light exercise, and even 1 to 2 weekly sessions of your gym. That is good enough to maintain your muscles which you have built already. And that training time, when to train, suppose you habituated to going to gym or doing exercise, what is the best time to do exercise during Ramadan? That is after Maghrib or after Taraweeh. That is best time because you won't be fasting and you can drink water, you won't be dehydrated, you won't be tired. So after Maghrib you can have your light iftar and some protein shake, go and do exercise. Afterwards you can just have your dinner. Or after Taraweeh, you can do, if you have energy left, you can do after Taraweeh also. And this way you can build up keep your muscles. Don't aim to build new muscle during Ramadan. Just if you maintain whatever muscle you have built, that's enough. And adequate sleep and recovery also is important during Ramadan to avoid muscle wasting. And then constipation is another problem during Ramadan commonly people face due to lack of fiber intake and lack of water intake. So the idea is should take high fiber diet in during both Sahr and Iftar time. So include dates because dates also have good amount of fiber, and also take fresh fruits which are rich in fiber like guava or papaya or other such fruits. And then also you can use prunes. Prunes are actually dried prunes will be available in the market. You can use those dried prunes. They are cure for constipation actually. And also take a lot of vegetables, green leafy vegetables, legumes, pulses, all these things, the beans. These have high fiber. And chia seeds can be used with soaked in water or in yogurt. Chia seeds also are good for fiber content, and you can use isabgol. This is available in the market. You can, suppose with food you are not able to overcome constipation, then you can eat before sleeping in the night 1 glass of water. You can mix 1 or 2 spoons of this psyllium husk or isabgol, and then you can drink it. So that will solve your constipation problem, inshallah. If still it is not solved, then you need to consult your doctor. So next, coming to exemptions from fasting. See, Islam is a natural way of life. Okay, it doesn't overburden any person beyond his capacity. So some people, those who are not able to fast, they are exempted from fasting. But not everyone is exempted. Okay, people, they try to make excuse for even small things. So like even mild people have some small light diseases. They are not that are not serious, like maybe having diabetes, which is mild diabetes under control with medication, oral medications, or mild hypertension, or mild heart disease, or even kidney disease also, which is in early stages or mild stages. It's not a problem at all. Even other diseases which are under control, you can just consult your doctor, and then you can choose, you can try. So, because Rasulullah said that one who omits the fast of even one day in Ramadan without any concession, without any Shari reason actually, or without being ill, he would not be able to make up for it in reward, even if he were to fast for the rest of his life. So the entire life also, if you fast afterwards, for that one fast, you won't get the full rewards. Understand? So that's why we should not try to miss any fasting, any even single day of fasting without proper Shari excuse. So, who are not supposed to fast, that is, the children who are not having before puberty, they are exempted from fasting, and women who are under during menstruation or during post delivery bleeding during that time, they are. It is unlawful for them to fast. Actually, it is haram to fast during that time for women. And then people may be excused from fasting in certain conditions, like a sick person or a musafir, a traveler who travels to a distance of 48 miles from one's own city, for and then pregnant or lactating woman, if she has a reasonable fear that fasting will cause harm to her own health or her baby's life. So this is important. Not every pregnant lady or not every feeding mother is exempted from fasting. Only if there is a fear, real fear that that fasting may harm her health or her baby's health. Only in that case. So you need to take consultation with your gynecologist and discuss with them. So they'll check your health status, and then they'll tell you properly whether you can fast or not. And then a person who is very old and decrepit, that is a person who is so old that he is not able to fast at all. Such a person, those people also, they are excused from fasting, and they can give fidya afterwards. So conditions for exemption from fasting in sickness, that is, if one has reasonable fear that his sickness will worsen or recovery will be delayed by fasting, only in that case, you will be exempted from fasting. That is important. So any sickness which you have risk that if you fast, it will worsen and your recovery will not be full, then you are exempted. And then uh, how to determine that whether really there is a risk or not? Then you should ask your doctor. Preferably ask an expert Muslim doctor who has good knowledge about these things. You ask them, take consultation. And if a Muslim doctor is not available, then you can consult even a non-Muslim doctor who understands this issues of fasting and all that. And then also, if suppose somebody has past experience of fasting and falling sick, and the same disease is there continuing now, so in those people also they can they'll be exempted from fasting. And also suppose there are clear signs, like suppose somebody is getting severe vomitings or severe diarrhea, then they know that okay, already there is vomiting, severe diarrhea is going on, so they'll be exempted even without consulting a doctor. They can skip the fasting that day. So these are the things for which make exemptions from fasting for a person. So fasting with chronic diseases, it is advisable for patients with chronic diseases like diabetes, hypertension, heart disease, kidney disease, or any other disease you have, chronic diseases. You better consult your doctor before Ramadan itself, at least 2 to 3 weeks before starting of Ramadan. Consult your doctor, because once you consult your doctor, you can see whether the dose of your medication can be adjusted to make you easy to fast, or your diet can be adjusted, or your lifestyle can be adjusted, or some tests can be done so that to see whether you are able to fast or not safely. So these things can be worked out before Ramadan itself, and you can also do a trial fasting during Shaban to see whether you are able to fast in Ramadan or not. So this is very important. So because not every chronic disease is exempted from fasting. And regarding diabetes, generally people with type 1 diabetics are on insulin. They are generally not allowed to fast generally, except for people who are having really controlled diabetes, even with low dose of insulin, and they are healthy otherwise. Then in those cases, some doctors may allow them to fast, but generally they won't. And then type 2 diabetics who are not having any complications and who are on oral drugs, oral tablets only, not on taking an insulin. Generally, they are generally it will be safer for them to fast, and they can consult a doctor and adjust their medication, because generally in fasting your calorie intake is decreased, so you need to adjust your dose of tablets as well as the timing of taking. Avoid taking at Suhoor time. You should diabetic drugs generally should be taken at Iftar time. So that you won't go into hypoglycemia during the fasting time. So these time adjustments and dose adjustments can be done by your doctor before Ramadan itself. You consult your doctor, and sugar monitoring can be done regularly during the diabetes during fasting period, so to see whether there is any problem with it. And also people with hypertension, with high BP, they also need to adjust their medications after consulting their doctors, and then they need to uh, uh, yeah, am I audible?
Yes, you are.
Yeah. Okay. So otherwise, you may land into low BP and then other problems.
You
So
might need to share your screen, sir.
okay, okay. Just give me 1 minute. Oh, just let me see. Screen is not seen.
Your presentation is not visible.
Okay, okay. Let me just. Yeah, it's coming now.
Yes.
Sorry for the interruption. So, so what's important is the key is you be in contact with your doctor. That is very important. Uh, So now let's see quickly what is the protocol for those who really struggle to fast. Um, that is, take at least 500 to 1000 milligrams of sodium, preferably a pre-made formulation at Suhoor with water. That is, if you take even ORS, that will be enough actually. And then a healthy Suhoor with a mix of fats, carbohydrates, and proteins, and without skipping any Suhoor. That's very important. And 1 to 2 tablespoons of medium chain triglyceride oil supplements. This helps, and this can be taken at Suhoor time. And also, you can take 2 tablespoons of L-carnitine at Suhoor, but this should be taken after consultation with your doctor, please, because some people it may be contraindicated to take these things. So better to have your consultation with your doctor. Then only you can take the supplements. And then if you are having coffee, you are ready to coffee, and then you can take caffeine supplements, long acting caffeine supplements in the day, 1 to 2 packets. So these things can be added at over time, and then optimize your sleep protocol to avoid getting tired, and then try to reach at least 6 to 7 hours, at least 6 hours of sleep in the during Ramadan. Within 24 hours should be enough. And then, of course, during the last 10 nights of Ramadan, we try to wake up and do ibadah in the nights. So that time, of course, everyone will have lack of sleep. But at least the initial 20 days, we should try to get at least 6 hours of sleep during Ramadan every day. And then we should have proper mental preparation and to avoid the nocebo effect, and preparation of for Ramadan before Ramadan itself by fasting, so to optimize the body's mechanism for fasting. So when these things are followed, then a lot of people have reported that it becomes very easy for them to fast. So Ramadan, and if we do all these things, inshallah, we should with the end of Ramadan, we should remember that we need to learn the essence of Ramadan, and make Ramadan as a bridge to healthier living. Okay, that is, we should re-examine our relationship with food. Nowadays, people are obsessed with food. The modern culture is such that people are obsessed with eating tasty food and varieties of food, exotic type of food, and overeating. Eating for every few hours, people try to eat. Every 1 2 hours, they try to snack. They to eat something or the other. So this is not good at all. This is a very bad habit. We should try to fix our eating time. We try to eat on the same time every day, and try to eat healthy food, avoid overeating, eat and stick to the sunnah method of eating. That is, eat only 2/3 of stomach, 1/3 of stomach, and 1/3 of for water, and keep 1/3 empty for air. So that is, if you follow this, only filling of 1/3 of stomach during each meal, if we have this goal, then we will not be overweight, inshallah, and our body will be lighter and healthier. And we can avoid a lot of our metabolic diseases which we are suffering today: diabetes, hypertension, heart disease, cholesterol problems, arthritis, lot of endocrine issues, and lot of issues. So many of the lifestyle diseases which humanity is suffering from, they can get relieved from all these things by fasting regularly. Even after Ramadan also, try to incorporate fasting in your schedules, weekly once or twice fasting, or at least 3 days in every month fasting. And then try to avoid overeating and mindful eating, to see what you are eating and try to connect with your food, what you're eating. Just eating while watching television, eating while watching your mobiles, this is not good. Try to focus on what you're eating, and and enjoy your food while eating. Chew properly for proper digestion. All these things should be inculcated in ourselves, so that our digestive system will be in a proper way, and our metabolism should be in a proper way. And so I've taken a lot of this material from this Ultimate Ramadan Guide by Dr. Abud Bakri of USA. So, and this is the link to my QR code from my YouTube channel. There are a lot of videos, educational videos, health videos, as well as Islamic videos. In this, you can, if you want, you can just take a screenshot of the photo of this QR code, and you can see it, inshallah. So with this, I'll end my presentation. Alhamdulillah Rabbil Alameen. Wassalatu wassalamu ala Rasulihil Kareem. May Allah subhanahu wa ta'ala make it easy for us to spend a healthy and good Ramadan, a productive Ramadan, and a very blessed Ramadan for all of us, inshallah.
Thank you, doctor.
There is one question you want to answer.
Yeah.
What suggestion for ladies having kidney stones is coconut water preferred?
Kidney stones, you need to drink at least 4 liters of water every day. That is important. So you see how you can adjust that time. And coconut water also is good anyhow. Any fluids, they are good, but try to hydrate more and more. 4 liters of water during the night time, from iftar time to suhoor time, you should drink to avoid stone formation. And also, please take a doctor consultation. You meet your urologist and also get an ultrasound scan done before Ramadan itself. So to see how much stones you have and where is the stone right now, is it causing any obstruction in the kidney, any hydronephrosis or something? Just see to it. So that you can plan whether you can fast or not safely.
Thank you, sir.
Okay,
We
so no
can
more questions, inshallah.
If anybody has any questions, they can ask or they can type, or else we'll end the session. Thank you, Dr. Sam.
Welcome.
We'll
Assalamu
end
alaikum.
the. Thank you. Assalamu alaikum.
Assalamu.